It's time for another podcast by George. Straight talk, straight from the heartland, that'll have you saying, "By George, I think he's got it." Now, here's George.
Hello, hi, how are you? Welcome back on into another podcast by George. Time for a coronavirus, a COVID-19 update. Yeah, I mean, that's what we've been visiting with Dr. Andrew Nish. Now, he's the medical director at John Stoddard Center here in Des Moines, Iowa, but he's been our COVID expert locally to give us the perspective here from the heartland. And we've got some, I don't know, for us now, if you're from Iowa, you know this is major news, and this is how I wanted to start the broadcast with Doc today. They've canceled the Iowa State Fair because of the coronavirus. Doc, I would assume that's a decision that you agree with.
I do, absolutely. You can't take over 11 days and put over 1 million people into, even though most of it's outside, there's still lots of confined spaces, and there's just no way to appropriately social distance. The sanitation is less than adequate, and so I think it's the appropriate decision.
Well, I thought it was a real eye-opener because it's easy to get confused by the news. You think, well, maybe we're getting over this. You see a lot of reopenings around the country, and you think maybe we're coming into the clear. And then it didn't take much as far as the decision. I mean, they just, no, we're not going to have an Iowa State Fair. And as I started off saying, if you don't have an Iowa State Fair in the state of Iowa, that's big news. That means they're taking it very seriously. Now, at the same time, our governor has basically given businesses statewide the option of, I think, 100% reopening it. You know, is that correct? Is that what's happening elsewhere?
You know, I'm going to be perfectly honest, George. I don't know. I don't follow the governor. Yeah. I'm trying to really give people practical advice. And so, you know, we're in a situation now where the virus is still around. It hasn't disappeared. It's not going to disappear. So what I try and concentrate on is how can people live their lives in as normal a fashion as possible, yet stay safe. So with the virus never going, you know, it's not going to go away. It is here. So how do we live with the virus, and what can we do to live with the virus and keep ourselves safe? So it's really a risk-reward equation to me. What risk do you want to take to do the things that you want to do? And so what are the risk mitigation strategies? How can we minimize people's risks so that they can really, you know, we don't want to be confined anymore. We want to be out. We want to be about. So what can we do as a society to make it as safe as possible? And well, that's really where I think the discussion should be.
Let me give you a for instance here. Now, this is very personal, but it's a pretty good example, particularly for older people. I need to go to the doctor, and it's not a major thing, but I would like to go. Now, I know the people in the doctor's offices probably are not going to work symptomatic, but my concern was maybe they might be going to work asymptomatic. Is that still a concern? And in particular, I wanted to ask you about something I saw in the news where the WHO, oddly enough, somebody came out and said that you're not very likely to get the coronavirus from someone that's asymptomatic. And I think since then, they've kind of walked that back. Where's that at, do you know?
Yeah, that's a great topic to talk about. So let's, number one, talk about the healthcare environment and how safe is it to go to the doctor.
Yeah.
So we just, Unity Point Des Moines, over this last 3 months, we have had 0 cases of coronavirus transmitted within the hospital itself. So I would consider the hospital to be very safe. I would consider doctors' offices to be very safe because they're all taking precautions of sanitizing, wiping, but here's the key: wear a mask. And I'd like to talk a little bit about masks later. But the real key, I think, is wearing a mask. And not necessarily, you know, you wear a mask to protect yourself, but you also wear a mask to protect other people. So it works both ways. And so I think we're at a point where we can safely go to a doctor's office and maintain and go back to our routine care, particularly if you have a chronic disease, if you have diabetes, if you have high blood pressure, if you have heart disease, if you have obesity, whatever it might be, and you have not been cared for properly over the last 3 to 4 months, we want you to get back to make sure that your chronic illness is under good control. Because we don't want to have all this disease burden and then all of a sudden people are in the hospital because they haven't maintained their health. So I think that you can safely go to the doctor. I really do. But again, precaution. And we are extraordinarily careful in the healthcare environment. If anybody has a symptom, do not come to work. And that's the same, and I want to really stress this point. The way we're going to, decrease the transmission of this virus is if symptomatic people stay home. And yes, we'll talk about the asymptomatic people in a second. But if you have any symptom, a cough, a new runny nose, a fever, a headache, GI symptoms, belly pain, nausea, vomiting, you've lost your sense of taste, you've lost your sense of smell, you have body aches, you have fevers, the coronavirus can present with a wide variety of manifestations. So it's not as simple as, oh, I have a cough and I'm short of breath and my chest hurts. There's a huge variety of symptoms. And so if you have GI symptoms that are new onset, if you have a fever, if you have aches and pains, all of a sudden, my muscles are stiff, they hurt. If you have a headache, stay home. Do not go out and infect other people. That's just so important. And, we live in a society where, well, that's badge of courage. I'm going to go to work when I'm sick. Those days are over. Those days are over. Stay home. And you know what? If you're really feeling symptomatic, go to a drive-through and get a COVID test if you want to know. But that's the key. Keep people with symptoms out of general circulation for at least 10 to 14 days. Now, what about, you asked about the WHO. What about asymptomatic people? And this is a real issue. The bottom line is we don't know. We don't know. And so the WHO came out and there was a big conference, on the TV, and it said, we think that the risk of transmission from asymptomatic people is very rare. And there, when you look online, there's incredible pushback to that. And that data basically came from contact tracing in I don't even know what country, looking at asymptomatic people and were they passing on the virus. The bottom line is we don't know. And you have to separate your truly asymptomatic patient, somebody who has absolutely no symptoms, from the pre-symptomatic patients. So those are people who have no symptoms, but 3 or 4 days later, all of a sudden have a cough, a sore throat, a fever, and then they get symptomatic. Oh. So we know that this coronavirus is spread in the pre-symptomatic stage. And so we have to divide those two. And we don't know how many asymptomatic people are spreading the virus, truly asymptomatic. 18%, 40%, we don't know. We don't know. And so I think it was premature for the WHO to say, oh, this is very rare, and let people just go the way they want. There was just another paper out, and it was published yesterday, and it was looking at if we universally all wore face masks, would that make a difference? And again, this is a geometric model. This is not real life. This is modeling based on what we know now. Their conclusion was if we had a high percentage of people wearing face masks, we could flatten that curve and bring the infection rate down dramatically.
Well, and you make a great point. I hadn't even thought. I think I'm pretty smart about this. But so you're talking about the spread of the disease by asymptomatic people that have the virus but are never going to get sick, as opposed to pre-symptomatic people that have the virus and they are going to get sick. They just haven't yet. That's the distinction that you're drawing there. Yeah, I hadn't even thought of that. Well, so much of this focuses on mask wearing and masks. So this brings me to another, and I mean, I think about this all the time. I'm on the internet, you know, I get this deluge of advertising for all these various types of masks, various and sundry types of masks. Some, you know, and it's marketing. They want to tell you that theirs is better than others. And I've even seen where they say, well, you just need to make sure that you're covered, and a cloth mask is fine. I think they're talking like even a bandana or something. Is there any particular mask for the general public, you know, not a healthcare professional, a medical setting, but just the average guy on the street that is better than another?
Yeah, so you have thousands of choices, right?
Yeah.
Thousands of choices. So there was just a study done at Argonne National Labs in Chicago, and they looked at different materials used for masks, and they looked at how well do those masks trap the virus. And so they looked at like a bandana. A bandana is not very good because it's not woven very tightly, so it's porous, and it really didn't protect people very well. Only the transmission rate through the mask was anywhere from 40 to 95%. So most particles were actually getting through a bandana. And then they looked at different cotton fabrics. So they looked at low thread count fabric and high thread count fabric. And so when you go buy sheets in the store, you see, you know, 800 thread count, 600 thread count. And that means it's a much tighter weave. And so the one thing we know is anything knit is not acceptable, okay, because it just is too porous. It lets the particles through. So like cotton t-shirts and things are not acceptable. You have to buy a woven piece of cloth. So they looked at low thread count cloths, cotton cloths, and they looked at high thread count. And when I say high thread count, it was 600. And what they found is that the high thread count cotton trapped the particles significantly better than the low thread count. So that was one aspect. But then they looked at different materials. So they looked at high thread count cotton, low thread count cotton, and then they looked at combinations of materials. So when you take a high thread count cotton and you add 1 or 2 layers of silk or chiffon, so chiffon is a combination of polyester and spandex, and you add that to the cotton, it increased the trapping efficacy significantly to the point where they were almost as good as N95 masks. So the devil is in the details on masks. And what this paper pointed out is the combination of 2 different types of material is probably better than one. The other thing that worked really well was quilting material. So in quilting material, there's 2 sides that are cotton, and then there's some batting in between. And that actually worked very well as well. And then also flannel worked well, a combination of cotton and polyester. So why is this combination working better? Well, we know that the cotton filters particles based on trapping those particles. But then these tiny particles, which can still spread the virus, they can be trapped by what we call an electrostatic charge. So there's an actual electrical charge to fabric, and that can attract the virus and trap it. And that's what the polyester and silk is doing. It's trapping not only by the mechanical trapping of the particle, but it's also trapping that particle by its electrostatic charge. So according to this paper, if we used a combination of high thread count cotton or, and then a second layer of silk, chiffon,
polyester,
quilting material, or flannel with part polyester and part cotton, those had the best trapping efficacy. So I think that we're maybe best off building our own with those types of materials or finding someone to do it. Now, the other kicker in this, though, is mask fit.
Yeah.
Okay. I was out yesterday. I had to get my oil changed. And so I'm waiting in the shop, and it's, you know, I'm reasonably far away from people. And there's an older guy with a mask. It was doing a great job on his chin. If you're going to wear a mask, wear a mask.
Yeah.
But I can tell you, he had no coronavirus on his chin because that mask was draped over his chin. And I wanted to just tell him, look, either put it on or take it off, but you look like a dude. But here's the key. Number one, you have to wear it properly. And fit is a big deal. So if your mask is ill-fitting, 60% of what you're breathing in and out is just going outside that mask. So one of the tricks that's been popularized and has been studied is taking a pantyhose stocking and putting that over the mask to really push it onto your face. And that seems right now, as far as a practical solution to fit, one of the best things that you can do. And by fitting it better, and the polyester from the pantyhose also helps trap particles. So that's actually one of the best techniques for fitting your mask and increasing the efficacy of that mask.
Well, it sounds a little bit like what they call a gaiter. Now, this is something else I wanted to get to you on, because you're an athlete, and you know, I'm a wannabe athlete. I like to play hockey. I would like to get back in the rink and play hockey. They're actually, believe it or not, here they are reopening some of the leagues. They've got some precautions in place, but I wanted to read to you the forerunner of opening up the rinks I had on my podcast. The place was down in Jacksonville, Florida. Now, these are some of the things that they're doing, and I'm going to read through this list. Now, when you walk in the front door of this rink, they have thermal scans at the facility entrance. They make a big deal about that. It's, I don't know, some kind of a thermal scan, thermometer, digital thing like they use in the airports and all that. Well, of course, that doesn't do any good if you're pre-symptomatic or asymptomatic. You're not going to have a fever, but you know, okay, so they're doing that. Not a bad thing, but that's a starting point. They have masks for the entire staff, including referees on the ice. They tell them that the refs have to wear masks. But I talked to the head of hockey operations down there, and a lot of the players aren't wearing them. What they're wearing, some of them are like gaiters, or like these turtleneck sweaters they pull up. They may have good material in them. I don't know exactly what but they call them gaiters. They don't allow fans, siblings, or extra people in the building. Not much of an issue where I play, because there ain't a lot of people watching me, folks. But all registrations and bookings are handled online over the phone before arrival. Upon reopening, each team was given 2 locker rooms instead of 1, with access limited to 20 minutes before and after the game. And to further prevent potential COVID-19 spread, games are held a minimum of 45 minutes apart, and that supposedly allows staffers enough time to clean and sanitize the facility. Okay, now I'm starting to go, what? Locker rooms are also fogged during games. So you go on the ice, they go in the locker room and fog it. Now, I mean, I don't want to be overly critical, but I got a feeling that's probably glorified Lysol spray can. I don't know what that is. Do you have any idea what they're talking about?
I have no idea what they're fogging with. Yeah, I don't know.
That sound like anything that would work? What about the rest of the steps?
This is a really interesting question, because now one of the discussions is, should we be sanitizing the air? Because some of these tiny particles can float around in the air for several hours. And so fogging may actually be beneficial, but we have no data to tell us that. But let's go back to the hockey players. You know what the best thing they can do is?
Yeah.
Wear a face shield.
Okay, a bubble, we call it. You know, the plexiglass regular hockey helmet shield, yeah.
Yeah, put your gaiter on. So a gaiter is just nothing more than this thing you wrap around your neck and you can pull it over your face. And a polyester gaiter may have some protective effect, but a mask, a face shield like we wear in the hospital, prevents this, you know, those particles from, that's trapping them on that face shield and preventing it from going out into the air. So they should all wear face shields.
Yeah, they definitely need that. The only thing I'll say about those face shields, they usually are grids or open at the bottom for better breathing. But you need one that is, you know, solid down, covering your mouth. Again, I mean, that's the whole idea. If you've
right,
got,
it has to cover the mouth, but it doesn't have to be tight against the chin.
No.
It just has to cover the nose and the mouth so that when you exhale, you're exhaling into the shield and not into the air. So that would be another mitigation strategy. Okay. And again, you know, this is risk versus reward.
Yeah.
And we can criticize openings, or we can say we should do this or that. But until we do some of these things, we have no idea what's going to happen. So we still have to follow it closely.
And the risk part of it that comes into play, you have to think about people other than yourself, which is my thing. I mean, for risk reward, for me, I'm kind of a Missouri mule. I've got a false self of strength and toughness. I think I could survive this. But my wife has poor health. If I bring home the virus to her, if I have it and give it to her, the consequences could be very grave indeed. You have to consider that. So that factors into my personal risk and reward, and everybody else has to also. If you do get it, who are you going to be around? Who else might get it, and what might happen to them? I mean,
exactly.
You've
that's
got
the whole thing. That's the whole thing about mask wearing. Mask wearing is more important to keep the virus, not as important for yourself, but it has more importance in keeping the virus away from somebody else. So we think of a mask as a risk mitigation strategy, but we should think of a mask as a public health strategy, meaning we should all wear masks to prevent the transmission to someone else, because that's where masks are most effective. Masks are most effective in people who are spewing the virus. They're less effective in those of us who are breathing and maybe breathing in the virus. So if every one of us thinks, I could possibly have the virus, and I'm going to put on a mask to prevent my fellow human beings from becoming infected, that's the real key to masks.
Yeah.
That's the real key.
Okay, so running out of time here, I quickly wanted to get to something else. These protests, demonstrations, even the riots that we've had. I was kind of mortified looking at that. You may have been also as a doctor, because these people are in very close proximity. A lot of them aren't wearing masks. You've got this damn tear gas and pepper spray in the air that irritates the eyes, nose, throat, lungs, obviously. That can't be good. We had some of that in Des Moines as an example. Have you seen any incidents of COVID infection that you think might be directly related to the protests, or are we still going to be kind of holding our breath for a week or two on that one?
Yeah, not yet. We're going to be holding our breath for a week or two. So we're too early right now. And, the virus did not create this, but it's brought out these deep-seated problems we have in society. And the riots are just a symptom of that. And, people are angry, and they need to express that emotion and that anger. And yes, we're all worried that, oh my gosh, we're going to have this huge COVID outbreak now because all these people were together. And again, the bottom line is we don't want to create hysteria right now because we don't know. We don't know. And maybe in 2 weeks or 4 weeks, we'll know that, hey, this wasn't such a good idea. But right now, I don't know the answer to that. We would think so based on proximity. But again, you have to understand they were outside. Okay. When you're outside, there's infinite air exchange. You're not in a closed environment where you're breathing the same air all the time. And maybe that's enough to mitigate a lot of the transmission. We just don't know.
I wonder.
So we'll see.
Well, that's great, because like I tell folks, if you want to, it's kind of like a guy that says he's tough, he probably isn't. If you want to know a guy that's smart, find a guy that says he doesn't know everything. That's a guy.
We want, this is what I've talked to people many times in the last few weeks about this. The only thing certain in life is uncertainty. And we as human creatures want certainty. So now you can see the struggle that we're all in. We want to be certain what's going to happen, yet we have no idea what's going to happen. And that creates tension, and that creates anxiety. So what I try and teach people is learn to embrace and be still with uncertainty. Because when you can do that, you can literally change your life. Because we go from this nails on the chalkboard, hanging on for dear life, to enjoying every moment. So embrace uncertainty. Embrace it.
That's great. Those are words of wisdom. That's a great way to end. Doc, thanks for coming back on Podcast by George.
Yeah, always a pleasure.
Folks, that's Dr. Andrew Nish. He's the medical director at the John Stoddard Medical Center in Des Moines, Iowa, talking about the COVID outbreak. And really, at the end there, a little philosophy that will stand you well when it comes to life in general. And that's going to do it. That's going to wrap it up. If you like Podcast by George, as I always say, like us on Facebook, follow us on Twitter. It's particularly important to subscribe on YouTube and ring that notification bell so that you get each and every podcast. And we'll circle back with the doc, because this ain't over, folks. As he mentioned, it's still here. It's still with us. And some people are saying we're already starting to see maybe the beginning of a second wave in some states and areas like Arizona, Texas, and so on. So we'll be checking back in whenever he's got the time. Believe me, I've got the time. But that's going to do it. That's going to wrap it up. That's another podcast by George.